Hi, I'm Representative Roger Goodman, and in this Good Minute, I want to highlight key pieces of legislation we're now considering that will improve our state's response and support for people who are suffering from mental health and substance use disorders. After intense debate, the House recently passed hundreds of bills out of our chamber. We sent those House bills over to our colleagues in the Senate for consideration, where they're currently being reviewed and will be debated soon. And here in the House, we're similarly reviewing bills that passed the Senate. Several of the bills we passed aim to improve our behavioral health system, treatment, services, and other supports for people with mental illness and substance use disorders, including House Bill 1574, which expands what's called our Good Samaritan law to address the situation when someone calls for help when a person is experiencing a drug overdose, which are sharply on the rise and have a deep adverse impact on our community. We've heard that the number one concern that stops people from calling 911 for assistance with drug overdoses is a fear of arrest. Under this bill, anyone who calls for help for someone experiencing a drug-related overdose or is themselves experiencing an overdose cannot be arrested or charged for drug possession. House Bill 1574 strikes a careful balance between accountability, public safety, and reducing harm for people with substance use disorders. House Bill 1432 ensures insurance coverage for treatment of mental health and substance use disorders. We've heard from families desperately seeking help for their children struggling with their mental health, but despite getting prescribed treatments from a doctor, they're being denied insurance coverage deemed not to be medically necessary. Some families have removed their children from private insurance because Medicaid would be more likely to cover the life-saving treatments they need. This is not acceptable. House Bill 1432 clarifies that insurance carriers must cover prescribed mental health and drug treatments so that people will receive the care they deserve. House Bill 1113 provides courts with more flexibility to dismiss low-level, non-violent misdemeanor charges. Right now, nearly half of all non-traffic and non-domestic violence cases are being dismissed statewide. These are often charges related to what are called crimes of poverty, including the inability to pay mounting fines or fees, or stealing food. But with dismissal, these people are not being connected to services they need that would help them from committing these crimes again. This bill creates a structure to divert people away from jail and requires them to complete rehabilitative services if they want their case to be dismissed. This way, they can take steps to move out of the criminal justice system once and for all, rather than just cycling through it. Finally, House Bill 1427 expands the Healthcare Authority's Peer Support Program, which certifies people who have experience with mental illness or substance use disorders to help others going through the same journey. Updates to this program include requiring more training on domestic violence, sexual assault, and human trafficking, and expanding access to peer support services by making specialists available at more clinics and community-based agencies. Letting people who are suffering from behavioral health disorders languish can lead them into dangerous situations, years of cycling in and out of the criminal justice system, and negative outcomes that ripple through our communities. So it's critical that we address these behavioral health issues, and these bills take important steps to help people directly and make our behavioral health care system more efficient and more effective. That's all for now. Thank you for your interest in public policy, and stay tuned for the next Good Minute coming soon.